Ebola Prevalence in West Africa from 1976 to present, presented by Miguel, Lenny, Elizabeth, Unji, and me, Rene Garcia. Introduction. In this presentation we will be discussing Ebola, with a focus on the prevalence in West Africa. In this presentation we will be discussing the extent of the problem, agents of disease, clinical symptoms, modes of transmission, prevention, both host risk factors and environmental risk factors, temporal variation, gaps in knowledge, and suggestions for further research. We will also be having review questions during each of our posts in Beachboard. What is Ebola? Ebola is a viral hemorrhagic fever caused by Ebola virus. The virus was first identified in 1976 during the first Ebola outbreak. Since 1976, there have been a total of 24 Ebola outbreaks according to the World Health Organization. As you may remember, the deadliest and most recent occurred in 2013 and did not officially end until 2016, last year. The extent of the problem. Mortality. During the last Ebola outbreak that occurred in 2013, Centers for Disease Control and Prevention reported a total of 28,639 cases, with 11,316 of those cases ending in fatalities. The actual numbers may be higher due to unreported cases, but just to give a little reference to the amount of people that had Ebola, the number of current enrolled students at California State University Long Beach is actually 37,430. So the total number of cases of Ebola in 2013 during the last Ebola outbreak was about more than half of the total enrollments of California State University Long Beach. The World Health Organization states that the average fatality rate for Ebola is about 50%. So one who contracts Ebola has a 50-50 shot of succumbing to the illness. The next slide shows a graph made by the Center of Disease Control and Prevention that shows the total number of suspected and confirmed Ebola cases in three populations in West Africa: Guinea, Liberia, and Sierra Leone. These three areas are actually the most impacted during the 2013 Ebola epidemic. Ebola not only took the lives of many people, it also cost thousands and thousands of dollars in both treatment and prevention. According to a study conducted by Barsh, Gorham, and Lee, the estimated societal cost of a single Ebola virus disease case can range. It can range from about $480 to $912 if the patient makes a full recovery, and up to $5,929 to $19,000 if the case ends in death. To the right, you'll actually be able to see a graph made by Barsh, Gorham, and Lee that breaks down the median cost in USD of an Ebola case. The top breaks it down by supportive case of Ebola virus disease treatment and PPE, which means personal protection equipment. The CDC also reports that a total of $3.6 billion were spent by multiple countries, such as the USA, to try and control the epidemic. Ebola not only took thousands and thousands of dollars to treat and prevent, it also hurt the economy's working force. The CDC reported that in Sierra Leone alone, they lost about half of the workforce in the private sector during the height of the 2013-2014 Ebola outbreak. The epidemic cost Liberia, Sierra Leone, and Guinea a combined total of $2.2 billion in gross domestic products, or GDP. GDP is actually a way that many economists use to gauge the health of a country's economy. Losing a lot in GDP means that in the long run, the country's economy will actually start to shudder and may eventually go into a recession.